Hi. So I was recently asked, what is clinical aromatherapy? So clinical aromatherapy is basically where you go to school and you study a little bit deeper into the chemistry of the essential oils and their therapeutic effects on the body. So when you come to me for an aromatherapy consultation, what I'm going to be doing is looking at the whole picture, not just what your symptoms are. Like if you are having anxiety or depression or anything like that, I'm going to be looking at everything going on. How do you sleep? How do you eat? What's changed in your life? How's your diet? Like, what types of things are you eating instead of just treating the symptoms alone? So if you are eating a bunch of junk food and you're not sleeping real well, you may have more going on than you think. So also with clinical aromatherapy, we're not necessarily better than um, other aromatherapists. We just have a different skill set. Just like me being a nurse makes me have a unique set of skills that I bring to the table for aromatherapy that somebody else might not have the same skill set, but they may have something different, such as a massage therapist, for example. They will have a different set of skills that they bring to the table when they're working with aromatherapy. So that's kind of how that works. But now, the difference between an aromatherapist and, say, an MLM rep, aromatherapists who are certified, whether it be a clinical or a certified aromatherapist, we actually do go to school, and preferably the school that you go to, you want to look to make sure that they are covered by or endorsed by the AIA and the NAHA, which are the two largest governing bodies over aromatherapy, and they kind of keep us in check. They make us keep up our certifications, keep up our education, our training. So that would be the difference versus somebody who has studied what a company puts in front of them to sell products. I'm not endorsing any particular product. Like, I'm not here to sell you essential oils made by any particular company, because I use a lot of different oils made by a variety of companies. So, and and the MLM companies, their products are good. Obviously, I've used them. I went there first when I was looking for help for my son, and I've learned so much since then. So, and I'm happy to impart that knowledge. And hopefully, I get to introduce you guys to some of my friends who are also aromatherapists who bring a different set of skills to the table than just what I have. But what I do offer, again, when you work with me, I'm 25 years a nurse. So I have a good working relationship with a lot of doctors in the area. Um, so that's always a plus. But also the clinical aspect. So I'm going to look at everything that's causing the issues that you're seeking help for. And that means what medical diagnoses you have, what medications you're on top of external factors such as, what's going on in your environment. How do you sleep? How do you eat? It's kind of like a holistic approach. And I like to think that it's also a complementary approach to work with traditional Western medicine, but it complements in the sense that we are working with, like, certainly not replacing. I am not the one that's going to tell you, you do not need your doctor. That will never come out of my mouth, because number one, I have a rare autoimmune disease and I do require help from a doctor. I use aromatherapy to help with a lot of my symptoms, but I will never ever tell you you don't need a doctor, because the truth is without my doctors, I don't know that I would be alive. And certainly without a holistic approach, I know for a fact, if it was not for my friend who teaches Ayurveda, who works with yoga, so she teaches, a lot of movements, and also she's a massage therapist. If it wasn't for people like her, I wouldn't be able to move, because the disease that I have affects everything. It's external, like it affects like your joints, your skin, your hair, but then also internally it affects your organs. So it can cause a lot of problems in that respect. So I'm not the one who's going to tell you no doctors. I'm going to tell you yes doctors, and if you need some additional help, I'm here to help you. So I hope that explains it a little bit better than my other videos. So I look forward to working with you.